My name is Matt, and I'm going to be talking to you guys about arthritis. So, what exactly is arthritis? Arthritis is the inflammation of your joints. The most common type is osteoarthritis and rheumatoid arthritis. Starting with osteoarthritis, this is essentially the breakdown of the cartilage that surrounds your joints. And this can result in some bone on bone grinding together. Some of the symptoms and risk factors for osteoarthritis. Starting with symptoms, it can be pain, usually during or after movement, tenderness, stiffness, loss in flexibility, and bone spurs, which is an extra bit of bone or lump that can form around a joint. Some of the risk factors are age, so older people are at greater risk. Sex, this is women are more at risk than men are. Added stress on joints. Genetics plays a role, and joint injuries. Next, we'll move to rheumatoid arthritis, and this is a little different in that it's an autoimmune disease, which basically means that your body is mistakenly attacking its own self. So in this case, it attacks a synovial membrane that actually lines your joints. And that membrane can become progressively inflamed and swollen. This can result in bone erosion or joint deformity. Some of the symptoms and risk factors of rheumatoid arthritis. Starting with symptoms, it could be tender, warm, or swollen joints, as well as joint stiffness, which is similar to what we saw in osteoarthritis. Furthermore, it can result in a fever or weight loss. And then in 40% of people with rheumatoid arthritis, they also have signs that don't involve joints, and that can be seen in the skin, things like the skin, eyes, lungs. And then the severity of rheumatoid arthritis can come and go. Some of the risk factors of rheumatoid arthritis are, again, women are more at risk than men are. Family history plays a role. Smoking can increase your risk. And then some environmental exposures, and those can be things like asbestos or silica that you can be exposed to that can increase your risk. So here we have what is to be a normal joint. So here we have the bone, and then we got the cartilage that protects the bone and the joint, and then the synovial membrane, which lines the joint. So as you can see in osteoarthritis, this is the arthritis where the cartilage is broken down. So you can see there's barely any cartilage. So you can imagine when that joint is moving, you get some bone-on-bone grinding, and that's where the pain and tenderness comes in. And then we have rheumatoid arthritis, and here you can see the inflammation where the synovial membrane was. And then you can also see some of the bone starting to degrade as well. So next we're going to talk about the nutritional needs for both osteoarthritis and rheumatoid